You can eat clean, work out regularly, and honestly feel healthier than ever, all while a fatal heart attack is quietly forming inside you. Sounds impossible, right? But the truth is, the heart doesn't usually fail with warning. It fails silently. The human body is incredibly good at adapting. So good, in fact, that it can hide serious heart disease for years, sometimes decades, right up until the moment it becomes deadly. That's why for so many people, the very first sign of heart disease is sudden collapse. Before we go any further, if videos like this help you understand how your body actually works, take a second to subscribe and turn on notifications so you don't miss future breakdowns like this. Now let's talk about what's really going on. To understand heart attacks, you first have to understand how the heart survives. Your heart is a muscle that never rests. Every single beat needs oxygen, and that oxygen is delivered through small blood vessels wrapped around the heart called the coronary arteries. Think of them like fuel lines feeding an engine. If one small line gets damaged, the engine struggles. But if a major line is blocked, the engine shuts down almost instantly. There's one artery in particular that doctors fear the most. They call it the Widowmaker. It supplies blood to the heart's main pumping chamber. When it closes, blood pressure drops, oxygen to the brain falls, and death can happen in minutes. So the big question is, how does something this dangerous form in someone who feels completely fine? A healthy artery is smooth and flexible, kind of like a brand new rubber hose. But over years and decades, things like high blood pressure, blood sugar spikes, smoking, stress, and even intense endurance exercise start to cause microscopic damage. Tiny scratches form on the inside of the artery. Your body tries to fix them. It sends cholesterol to patch the damage. Then immune cells show up to help. But the repair never fully goes away. Over time, cholesterol, calcium, and immune cells harden into plaque. This process is called atherosclerosis. Most people picture plaque like a pipe slowly clogging up. They assume they'll feel it happening: chest pain, shortness of breath, warning signs. That makes sense logically, but biologically it's wrong. As plaque builds up, the artery often stretches outward to keep blood flowing normally. So the opening stays open. Oxygen keeps getting through. You feel fine. You can exercise, work, and live your life without any obvious symptoms. And that's exactly why heart disease is so dangerous. It stays quiet. So what actually causes the heart attack? It comes down to stability. Some plaque is hard and stable. Other plaque is soft, inflamed, and fragile. Think of it like a blister under thin skin. A sudden spike in blood pressure, extreme stress, or intense physical effort can cause that thin surface to tear. This is called plaque rupture. When that happens, debris spills into the bloodstream. Your body panics and forms a clot. And within minutes, that clot can completely block the artery. Blood flow stops. That's a heart attack. But here's something most people don't realize. Not all heart attacks come from fully blocked arteries. Imagine someone who's fit, active, and only has a moderate blockage. At rest, that blockage isn't a problem, but during intense activity, the heart suddenly needs way more oxygen than the artery can deliver. Supply can't meet demand. The heart muscle starts to suffocate. Cells begin to die. This is a different kind of heart attack, and it often comes without dramatic chest pain. Here's the scary part. Most heart attacks happen in arteries that are less than 50% blocked, because soft plaque is more likely to rupture than large, stable plaque. And most people don't feel symptoms until an artery is over 70% blocked. Below that, your body compensates. Above that, the warning signs finally show up. The heart does have one advantage. Over time, it can grow tiny detour vessels called collateral circulation. These act like side roads when main arteries start failing. This is why older hearts sometimes survive attacks that younger hearts don't. Time builds protection. In emergency medicine, there's a saying, time is muscle. After about 20 minutes, heart damage becomes permanent. After 90 minutes, living muscle turns into scar, and scar tissue doesn't pump. So how do you spot danger before symptoms appear? Blood tests aren't enough. They only tell you what's floating in your blood, not what's sticking to your artery walls. To actually see plaque, you need imaging. A coronary calcium scan shows hardened plaque. A 0 score is ideal. A coronary angiogram goes even further, revealing soft plaque before it ruptures. It's one of the best early warning systems we have. Heart attacks in healthy people are rarely random. They're usually invisible. Control your blood pressure, manage your blood sugar, keep moving, but don't guess. Use the tools we have to understand what's happening inside your body. And if you found this helpful, let me know in the comments. Have you ever had your heart checked, or would you consider it now? Make sure you're subscribed, turn on notifications, and I'll see you in the next one, because biology doesn't care how healthy you look on the outside.